Great. Thank you everyone for joining. I will now hand the meeting over to Chair Boatwright.
Good afternoon, everyone. I'm calling this public hearing to order at 4:40 p.m. in accordance with the Building Emissions Reduction and Disclosure Ordinance regulations adopted pursuant to the Building Emissions Reduction and Disclosure Ordinance, Boston City Code Ordinances, Section 7-2.2. The BERDO Review Board will hold a virtual public hearing at 4:30 p.m. on April 28th today to review the following topics in regards to the reduction of greenhouse gases from building, energy production, and consumption so as to promote the public health and welfare of Boston residents. In accordance with the Commonwealth of Massachusetts executive order suspending certain provisions of the open meeting law, we are conducting this public meeting online to ensure public access to the deliberations of the BERDO Review Board. The public may access this call through telephone and video conferencing. Members of the public will have an opportunity to provide public comment during the public hearing. To do so, please raise your hand or type in the chat in the application via the Zoom meeting platform. If you're calling in and cannot use the platform, you can raise your hand by pressing *9, or you can send your questions to staff via email at berdoreviewboard@boston.gov. For the record, I am Jessica Boatwright, chair of the board, and I will now conduct a roll call of board members. Board members, please say your name in the order that they appear on the slide. Jessica Boatwright.
Councilor Gabriella Coletta, and I'm here. Thank you.
Gail Lattimore.
Jack Nelson.
I'm sorry. I was having problems with the button. Reginald Stovall.
Great, thank you. Staff will now introduce themselves.
Hannah Payne, Director of Carbon Neutrality in the Environment Department.
Diana Vasquez, BERDO Review Board Manager in the Environment Department.
Claudia Diaz Martinez, Policy and Equity Advisor, Environment Department.
Ziggy Chin, BERDO Review Board Assistant in the Environment Department.
Thank you. Here's the agenda for today's meeting. We're going to start with hearings for 3 building portfolios. Then we will switch to our public meeting where we will approve the meeting minutes from our previous meeting, April 14th, and hear administrative updates. And then we will adjourn the meeting. So our first agenda item is a public hearing on building portfolios, but I'm going to hand it back to staff just to talk a little bit about the public hearing versus the public meeting sections of what we're going to do today.
Yes, thank you, Chair. Yeah, very quickly, we've heard that there was a request or some need for clarification between a public meeting and a public hearing, and that we totally understand that. It is they're very similar, so just wanted to take a couple minutes today to sort of outline the differences, what we mean when we say public meeting versus what we mean when we say public hearing. So during a public meeting, the BERDO team prepares the slide deck and we present on behalf of the applicant's application. We tend to summarize the application and present that to folks. During a public meeting, there is no public comment period. And then the board may ask, has a Q&A question where they ask clarifying questions about the application. Versus a public hearing, the applicant prepares a slide, sends a slide deck, and the applicant presents sort of a summary of their application to the board. The chair opens a public comment period, so that's a comment period where any member of the public can submit a comment, and then the board can ask, also has a Q&A section, but they can ask more detailed questions about the application. It's sort of a more intense. I think the public hearing tends to be longer, and the public meeting tends to be shorter, etc. The public hearing has more steps, those kinds of things. So hoping this helps demystify what we mean by when we say public meeting or public hearing, but also if there are any questions, happy to clarify as well. I'll hand it back to you, Chair.
Great. Can I just ask, are, are there any questions by raise of hand? Great. All right, we are gonna move on with our public hearing. So I will hand the floor over to representatives from Boston University, and if you could start out by introducing yourself, that would be great.
Thank you. This is Dennis Karlberg. I'm the Chief Sustainability Officer for Boston University. Today, we are here to seek the Review Board's approval of Boston University's building portfolio and ICS applications as presented at our first hearing on March 24th. At that hearing, the Review Board asked that we not use Mass DEP emissions factors for our individual compliance schedule and instead use the ISO New England emissions factors, given the shorter time frame in which those emission factors are published. So we have changed our emissions factors to ISO New England as requested by the board. I'll now turn it over to Gabrielle Brewer, our sustainability analyst, who does our BERDO reporting. Next.
Okay, thank you, Dennis. And Ziggy or Diana, are you able to move to the next slide?
Oh, apologies.
Oh,
We
I think,
did include
okay.
an update. Sorry. So yeah, I can chime in really quickly. Just
Thank you.
super quickly. Um, Staff and for the board, Gabrielle also has a slide that shows the same thing, but just wanted to show the updates on the ICS. So BU did come back, recalculated the individual compliance schedule using ISO New England historic emissions factors, which is what staff recommended, and just wanted to show that the ICS does have the 50% reduction from baseline and does have the 100% reduction by 2050. And this is the comparison of what the proposed ICS to default emissions looks like. But as I mentioned, Gabrielle also has a slide on this, so now I will switch it over to Gabrielle.
Thank you, Diana. Yes, as Dennis mentioned, I'm a sustainability analyst for Boston University, and we have updated our baseline electricity emissions to ISO New England. So the Charles River campus with a 2006 baseline uses an emissions factor of 350 kilograms CO2 per megawatt hour. The medical campus with a 2014 baseline uses 292 kilograms per megawatt hour. And the Fenway campus with a 2019 baseline uses 248 kilograms per megawatt hour. Next slide, please. This chart may look familiar. We have updated the version that was shown at our last meeting to reflect the new baseline with ISO New England electricity emissions factors. For those of you seeing this for the first time, this shows BU's projected emissions and targets with a baseline metric tons of carbon calculated by applying emissions factors to the total energy consumed during the baseline years. In a business as usual case, projecting our CY23 emissions out to 2050, which you can see in pink, BU is above target until 2035. Next slide. Okay, that is all we have for our presentation, and Dennis and I would be happy to answer any questions you may have regarding these changes to our application. Thank you.
We'll move on to comments from Environment Department staff now.
Yep. So just highlighting again, Boston University originally came before the board, and the board requested a recalculated individual compliance schedule using ISO New England emissions factors for the grid instead of Mass DEP emissions factors. Once BU resubmitted their application, the staff checked and it looked good and it was complete. And so with that in mind, the staff recommends approving the combined building portfolio and individual compliance schedule application with standard conditions. Thank you, Chair.
Thank you. I will now ask the board if there are any questions or comments that they'd like to discuss. Before we start, I should note that if we are entertaining special conditions today, we will have to continue this application to a following hearing in order to review and discuss the special conditions of the applicant. Alternatively, we may make requests of the applicant for items we would like to see in their emission standard compliance plan when it is submitted in 2 years. As a reminder, requests for the emission standards compliance plan are not considered special conditions. So I'm first in the alphabet, and I just I want to thank BU for going back and sharpening your pencils on this. It's really helpful, and it's meaningful how quickly you were able to translate things into the standards that we requested. My only question is, this translation is really helpful, and I'm curious if it has triggered any changes in your actual work plan or any of the steps you'll be taking, or if it's really just about the analysis that you're going to provide to the city of Boston.
Chair Boatright, I think it's not really changing anything substantial. It is changing how we report to other third parties that we talked about at our last hearing. So we have to do some updating there. As we mentioned, we're updating our climate action plan. And in that process of updating our climate action plan, we are revisiting our abatement curve to use the same base emissions factors as ISO New England. So there's a lot of change that's going on in just the general background analysis. But as far as anything substantial with respect to how we think about the changes we need to make, I think that will come out of our climate action planning process.
Thank you. Councillor Coletta Zapata, do you have any questions?
No, just a comment. I do want to acknowledge and appreciate Boston University's response to the board and also staff by updating your presentation and your proposal to align with ISO emission factors. It's critical for consistency across this practice and trying to implement BERDO just for equitable treatment of all building owners and maintaining integrity and tracking our citywide decarbonization goals. So just wanted to comment and say thank you. And I look forward to supporting this. Thank you.
Thank you. Board Member Lattimore.
Yes, thank you. I also appreciate BU updating its standards and the way the city acts. Also, I can't recall if we had asked for any additional information on the EJ plan, but as I read the EJ plan, I did also appreciate that. So thank you for that more extensive, if that's the case, piece. I did wonder, I think I saw somewhere in your EJ plan or somewhere in your documents that you were referencing perhaps doing some of the decarbonization work using some federal funding. Just curious about if there are any implications for your plan based on what's, the federal funding scenario.
Well, we don't really know what that federal funding scenario is going to look like. So the way we're thinking about the IRA in particular, we certainly have taken advantage of that with the solar that we've installed on campus, and we intend to continue to do that as long as the IRA is in place. So as we update the climate action plan, the way I'm looking at it at the moment is we have an upside risk with the economics improving if we have the IRA in place by the time we make those applications. So that's how we're approaching it.
Thank you. No other questions.
And we do plan to update our emission standard compliance plan in 2027 before the final draft is due, and that can more accurately represent where we stand.
Thank you. Board Member Nelson.
I have no questions. Thank you.
Board Member Stovall.
Thank you for complying and helping us be more uniform. We appreciate that. I have nothing else to add to it.
Thank you. We will now open the meeting for public comment. As a reminder, members of the public, if you want to provide a comment, please raise your hand or type the comment in chat. And if you are calling in and cannot use the Zoom platform, you can raise your hand by pressing *9, or you can also send comments to staff via email at BERDO@boston.gov. Are there any comments from the public? All right. Seeing none, we'll move on. And I will ask my fellow board members if there's any further discussion or questions, or if there's a motion to approve this application. It could be a motion to approve with standard conditions, or a motion to continue this hearing to discuss potential special conditions with the applicant.
Motion to approve with standard conditions.
Is there a second?
Second.
Again,
All right, so I will now ask on the motion to approve Boston University's application with standard conditions. How do you vote? And board members in favor, opposed, or abstain? I vote in favor. Counselor Coletta Zapata, how do you vote?
in favor.
Board member Lattimore,
In favor.
board member Nelson,
In favor.
board member Stovall.
In favor.
All right, the ayes have it. The motion passes. Boston University's building portfolio has been approved. Per the regulations, the Environment Department will send a copy of the written decision letter within 7 days. Thank you very much for coming back and for your thorough reply.
Thank you all.
Thank you.
Hi, Chair. It seems we received a message in the chat that there was someone did want to make a public comment. Maybe they just, it seems like maybe weren't
Okay.
able to receive the video. I don't know.
Right. Virginia Marcotte, is that the?
I think there are several people from Mothers Out Front. I don't know whether there's some order that we were expecting to speak in. Can you mute yours, honey?
Yeah, I did.
Okay, sorry, I guess I jumped the gun. I'll talk later.
Okay.
Oh, okay. All right. Okay. So we are now gonna move on to the building portfolio hearing for Boston Medical Center. So I will hand the floor to representatives from Boston Medical Center if they could introduce themselves.
So I should go in the other room.
Hi, good afternoon. This is Matthew Keith with Bridge Energy Services, and I'm also joined by Corey Pouliot and James Kidd from Boston Medical Center.
Thank you. You're welcome to go into the presentation.
Thank you for the opportunity to meet with you all again. If you wouldn't mind just advancing to the second slide. So just as a point of background, Boston Medical Center was formed by a merger between Boston City Hospital and University Hospital. They're a private nonprofit with a public mission. BMC takes a holistic approach to healthcare, and part of their mission statement is founded on the belief that health equity and environmental sustainability are intertwined. By minimizing harms to the environment, BMC is keeping the patient population healthier. And later in this deck, we have multiple examples of BMC's community outreach programs that we'd like to share with you today. BMC is the largest safety net hospital in New England. Over 70% of their patient population is from underserved communities, including greater than 70% are minorities, greater than 50% are from low to moderate income houses, and greater than 30% are non-English speaking. You can advance to the next slide, please. So just a quick overview. We can skip this one and move forward. So this is just a brief summary of the buildings that we've included in the application. This spans the main hospital, the Preston Family Building, the Crosstown Center, and the Old Evans Center. It's a mixture, 1.4 million square feet, mixed between healthcare and office space. Based on our building emission standard that we submitted in the application, our target for 2025 is just over 20,000 kg CO2 equivalent per year. We can skip forward through slides 5, 6, and 7. We received a handful of questions from BERDO board members after our public meeting, and thank you for the clarification on that at the top of this meeting. We did provide answers on subsequent slides 6 and 7, but I think that we'll just naturally answer these as we go through subsequent slides. If there's anything that you want to come back and revisit, we can do so at the end when we're taking questions. It looks like some of the text didn't come through, but I'll fill in the blanks here. In regard to emissions targets, BMC's emissions are roughly split 1/3, 1/3, and 1/3 between electric emissions, emissions from natural gas usage, and emissions from steam usage. In regard to our BMC's preliminary electric compliance strategy, they have 2 assets in place currently that will offset their electric emissions for the foreseeable future. One of those is a virtual power purchase agreement outside of New England. It was a partnership with MIT and the Summit Farm Solar Project in Connecticut, or in North Carolina. That produces approximately 26,000 megawatt hours per year. In addition, BMC serves as the anchor subscriber to 4 local community solar projects in the eastern part of the United States, which also qualify, and that equates to about 15,000 megawatt hours per year. On the non-electric compliance side, BMC's partnered with a healthcare sustainability consultant called Oakwell. In regard to electrification, anytime that heating equipment is replaced, they're exploring electrification options. And actually, currently, there's a project in progress where ground source heat pumps are being installed in their main lobby. In regard to steam emissions, they're in negotiations with Vicinity for their e-steam product, and they're also undergoing a steam line insulation project to reduce their emissions there. And you can jump forward to the next slide. And just from an overall perspective, this is how BMC's emissions profile based on the benchmark year of 2023 lines up to their proposed building portfolio application standard. Although they're over in terms of total emissions currently, the electric emissions through the aforementioned VPPA and community solar projects will be offset pretty significantly out until after 2040. So the primary focus here is going to be on developing strategies to electrify or reduce non-electric emissions in the future. One of those assets is the CH&P system, which I know we got a question on. A little background information there that the CHP is considered critical infrastructure for BMC. It provides redundant power, heating, cooling, hot water, chilled water for the main patient care areas of the hospital. And based on other regulations that BMC has to follow, having redundant power there is absolutely essential for being able to provide patient care. So we had received a question about decarbonization strategies there, and BMC is certainly open to evaluating options. And if a hydrogen blend were to be available in the future, they would absolutely be open to converting, but at present, that piece of equipment is considered critical for hospital operations. So, Corey, feel free to chime in there and offer any additional thoughts on that topic, and you can take it from here.
Sure. Hi, Corey Pouliot. I'm the Executive Director of Facility Operations. I'm going to go over a few of our environmental justice slides. During our last session with the board, we cut really short at the end of the meeting, but I know there was a lot of concern about the environmental justice component of Boston Medical Center and what was put in the application. So as we've updated that, we've also included some slides to go hand in hand with that. So if we can go to the next slide, please. So we want to take a look about our organization and how we look at our commitment for implementing sustainability across the entire campus. Here's just a quick snapshot. And in order for time, because there are a lot of slides here, I think everyone on the board has a copy of this slide deck. I'm not going to spend a lot of time on each slide, but I'll hit the highlights of each point. All of our leadership here at the medical center all take a certain ownership in sustainability at the medical center. As you can see from here, the commitment we have in just internal meetings as an organization. Next slide, please. Beyond the outside component, we also have commitments not only in the city, but in the state as well as nationally. And here are just a handful of organizations that we meet with, whether it be on a monthly, quarterly time frame throughout the calendar year. Next slide, please. So when we look at it, the environmental justice overview, we've been a leader in the healthcare and sustainability and environmental justice. We've embedded climate action into the core mission of delivering equitable healthcare to all of our patients. So we look at this, as Matt had mentioned, in a holistic approach. We look at everything from waste management, food and nutrition, real estate and optimization of our buildings and our green spaces, environmental justice, as well as patient well-being, staff engagement, sustainability when we look at procurement. Next slide, please. So I'm not going to read all of these, but back in 2011, there was a strategic master plan where we looked at the entire campus to look at optimizing the campus and the buildings that service the campus. That was kind of our campus redevelopment we affectionately call 1.0. We are currently in our institutional master plan, which is campus redevelopment 2.0, where we're making changes, as Matt had mentioned earlier. We have a major project going on where we're increasing the number of patient beds, operating rooms, and also streamlining our entranceways and main entrances to the building, and using some new technology in heat pump area to service that area. And then we have a sustainability vision statement, which is important, but the gist of it is, we're looking at all the resources we use and we manage. And if we do that efficiently and effectively, every dollar we save can be sent back to patient care. and the patient population that we serve. And that's how we look at it. Next slide, please. Matt had mentioned earlier, here's the patient population that we support. Approximately 70% of our patient population identify as people of color. Over 50% of our patient population is just around the federal poverty line, as well as approximately 30% of our patient mix does not speak English as their primary language. Next slide, please. We also look at who our staff is. Over 50% of our staff identify as either 2 or more races, Hispanic, Latino, Black or African, or American Asian. We're also 75% female, 25% male breakdown of our staff population. And you can also see the age groups of employees that we have in our department as well. Next slide, please. Here is just some local, regional, national sustainability pieces for Boston Medical Center that's hit the news. One of the big articles right there is in March of 2025. Boston Medical Center received its Sustainable Healthcare Certificate from the Joint Commission. There's also be a later slide we can look at the partnership between Boston Medical Center and Takeda, which has some really amazing things going on with that as well, and other articles as well about the work that we're doing. Next slide, please. So we talked a little bit about the cogen. I'm not going to go into a lot of details about this, but again, one of the reasons we looked at the cogen was the sustainability as well as the resiliency piece of it. The cogen plant itself, where produces 2 megawatts of electricity and all of the heating need for our inpatient units, runs approximately 75% efficient on a monthly basis. That is a much higher efficiency rating than we find from any other conventional type boiler or chiller type plant. And this gives us a certain level of resiliency. As long as we keep the gas on, we can provide heat and electricity to our inpatient areas indefinitely. Next slide, please. We talked about our first of its kind PPA back in 2016 with MIT and Post Office Square. This was our Summit Farms. This is a 650 acre solar farm where we purchased all of our required electricity needs through. It was a contract that we have many, many years left with, and we thought it was a very smart decision to make at the time and to lock us in. Next slide, please. Here is just some of the different programs that we do to support our local community and the neighborhoods. If you go to the next slide, there's a little bit of detail. I'm not going to read into each of one of these, but you can see many of these programs have been in place for over a decade, supporting many different programs across our community and in our local neighborhoods, as well as the city. Next slide, please. Here's a program that I think has gotten a lot of publicity lately. I think a lot of people are aware of it, is our Clean Power Prescription Program. This is a program where we have installed photovoltaic cells on a roof of one of our buildings. And instead of us taking the credit that this plant generates, we actually push this back to our patients. We have realized that there's a energy insecurity with our patient population mix. A lot of them have a hard time paying the utility bills, especially if they have medical equipment that they need to operate at home. So individuals can apply for this program. And basically, it's roughly about a $50 per month credit applied to their electricity bill based off of the energy that we generate on our roof. It's been a very well subscribed program. We did take advantage of IRA funding from the federal government to push this program forward, and it has been very well received, and we're looking to duplicate this many, many more times in the future. Next slide, please. Again, I talked about a little bit about this program with Takeda. We have a 3-year commitment with them where they're going to work with us, and part of that is some financial contributions to expand our Clean Power Prescription Program, and also to work with us very closely to look at how they, as a manufacturer, can reduce their waste. packaging waste specifically for the medications and the pharmaceuticals that they produce. This is going to be not have just local impacts, but actually global impact, depending on the findings of this program that we're working on them with. Next slide. Our food pantry. This is one of the programs we have had running since 2001. We provide, I'm doing the air quotes here, prescriptions to our patient and neighbors where they can come to the food pantry twice a month and they can get a week's worth of fresh produce from our food pantry. Again, this has been in operation since 2001, and we have served over 1.5 million individuals through our pantry. Next slide, please. Our test kitchen and our teaching kitchen. This is something that's also open to the community as well as our patients, where we can provide them training and services and education on how to cook and use the food that they're getting from the food pantry, as well as our rooftop garden, which I'll get to in a minute, and learn on classes on how to cook for diabetics, people managing weight loss. Pediatric nutrition is also a big one as well. And we do that for our local community. Next slide, please. Our rooftop garden. This has been a big hit. 2017, we opened our first rooftop garden. That produces just over 4,500 pounds of fresh produce every summer, every growing season. We also have 2 beehives that produce fresh honey. And the produce that is produced goes to our food pantry as well as used in our own cafeteria. 2024, we opened up our second rooftop garden, which produces over 6,000 pounds of fresh vegetables. And we're currently working with the city to look at adding a third rooftop garden to increase our growing capabilities. Next slide, please. How we're greening our ORs. We're looking here. One of the things that we've done in this past year is we've reduced our need on pipe nitrous oxide. We know that's a heavy, has a heavy emissions factor to it. So we want to reduce the waste. So we've taken that out of our program completely and we've gone to tanked and cylinder usage. We look at the energy efficiency in our ORs. We put them into a setback mode in the evenings. We look at our lighting evaluation for our ORs. ORs like laboratories are very high energy intensive operations. And we understand that and we want to be able to find any savings we can, as well as use our OR space as efficiently as possible. And then we look at the waste that's actually streaming out of the OR. What can be reprocessed, what can be reused, what's disposable and what's not disposable. And we're looking at programs there where we can reduce actual waste going to landfills, what can be recycled as well as reprocessed. Next slide, please. And then in 2022, BMC was one of the original signatories to the White House Healthcare Climate Pledge. Our commitment was to look at scope 1 and 2 greenhouse gases and reduce by 50% by 2030, as well as reach net zero by 2050. We've achieved near-term goals in 2016, following the execution of that Summit Farms PPA, that VPPA, sorry. And in 2019, BMC had achieved a 50% reduction in local-based scope 1 and 2 emissions. I know that was quick. I know that's a lot of information, but I'm sure you all have the slide deck as well as the written narrative for it. So next slide, please. So any questions?
Great. Thank you. Before I go to board members for questions, I do just want to ask Environment Department staff if you have any comments.
Yeah, just providing a quick summary. So originally, when BMC submitted their building portfolio application, all the buildings were found to be in compliance with reporting and verification, and was deemed complete. Then BMC came before the board on March 10th, which is when the board requested a hearing. And so this is now BMC's hearing. With all of that being said, we reviewed the application and it seems, oh, well, I should mention that the reboard did seek for more information regarding BMC's EJ narrative, which is what BMC is doing today. So with all of that in mind, staff recommends approving today's application with standard conditions. Thank you, Chair.
Thank you. I will now ask the board if there are any questions or comments that they'd like to discuss. Just a reminder, if we're entertaining special conditions today, we'll have to continue this application to a following hearing in order to review and discuss the special conditions with the applicant. Or we may also make requests of the applicant for items we would like to see in their emission standard compliance plan when it's submitted in 2 years. Those requests are not considered special conditions. So I'll ask the first question. I'm just curious, have you had a chance to review your power purchase agreement with the BERDO staff? And can you tell us where you are in that process?
We haven't yet,
Yeah.
is the short answer, but it is something that we plan to do.
And it's my understanding that our approval, that's a separate matter from our approval of this plan, that we can separate those, but it will be helpful to know if anything comes up during that review. Also, just because you ended with your status as being one of the original signatories to the White House Healthcare Climate Pledge, just curious if there's anything in your plan that was funded federally that where you've sent, where you've either seen funds move or you're planning for alternative funding right now.
Right now, we are planning for alternative funding to other programs we have in place. With the changes that are going on in DC right now, we're not sure what's going to happen, like everyone else. So we're staying close to our partners over at the Department of Energy as well as Department of Treasury, so we can keep an eye on what's going on with the IRA and what's going to happen with that. And more importantly, long-term with DOE and what funding and grants and programs are available.
Thank you. Councillor Coletta Zapata, do you have any questions?
Thank you so much, Chair. I just want to recognize BMC's leadership in health and sustainability. You all are really strong in this area. I'm also cognizant that a lot of BMC's patients are overwhelmingly from marginalized communities and EJ communities. And so I appreciate the institution's view of health equity and environmental sustainability is intertwined. I've personally visited a rooftop farm for food access, and the fact that you provide solar credits for low-income patients is really innovative. So I just want to thank you for that. So I'm always trying to bring it back to BERDO's goals and climate inequity, and maybe just push gently for more specificity around timelines and EJ impact measurements. So and I'm sorry if I missed this in the presentation, but how are you measuring and reporting the local health benefits that your decarbonization efforts will deliver to some of these communities?
So we do work internally, and there are measurements that are taken. I'd have to get back to our medical officer for our sustainability team, who does track that information. The power prescription program was really her brainchild and really wanted to bring that. And I know she is tracking that. There are some metrics that we are using because we do have to report back. There's something going on with DOE. There's an award ceremony coming up at the end of the week, and it's recognized, and some of that had to take on, we had to provide the metrics we were using to show, but that can be provided when requested.
Okay, thank you. Thank you, Chair.
Thank you, Board Member Lattimore.
Yes, excuse me, thank you. I think that Chair, you and board member Councillor Coletta Zapata did put some of my appreciation and viewpoints on the table. I do appreciate the much more extensive EJ plan as a former patient of BMC, as well as someone who, with great intentionality, chose to have all of her children be patients of BMC. I'm aware of the importance of the organization and how they serve the community. And also wanted to see a little bit more about, you know, the EJ plan. So very much appreciate the time and the additional information. I was also impressed on some things I knew about, because I do work with some of the staff over at BMC, most particularly Dr. Thea James and Dr. Megan Sandel, who are very strong advocates in these areas, environmental justice and housing, affordable housing, et cetera. But I did not know, and was also impressed with the, you know, the Clean Power Prescription Program, and particularly, you know, the transfer of credits to EJ household electric bills. Would love to know more about that, as that's something that Codman, the agency I run, has been trying to achieve. We also have some excess energy, but we ran into some roadblocks. So if it's someone that's already on this call, Matt or Corey or James, that I can talk to afterwards, I'd love to do that. That's just an aside. So I do appreciate that program in particular. So I thank you for that. And I would just say also, I think the hospital's doing great work. I would just say also, and this is not any special condition, but that with the admissions compliance plan in 2 years, I'd love to see a review of, you know, any MBE utilization efforts on the decarbonization plan work. So I don't have any other comments, but thank you.
You, Board Member Lattimore. Board Member Nelson.
Thank you for the presentation. I have no questions.
Thank you. Board Member Stovall.
All I have to say is much better than last time. Much better.
Thank you. We will now open the meeting to public comment. As a reminder to members of the public, to provide public comment, you can raise your hand or type in the chat in the application that's in the Zoom meeting platform. If you're calling in and so you can't raise your hand, you can press *9 to raise your hand, or send comments to staff via email at BERDO@boston.gov. Also, of course, if anyone's having issues where those things are not working, you can raise your voice and I will do my best to recognize you. All right. Hearing no comments, I'll double check the chat. All right. Are there any further discussion or questions from the board? If not, is there a motion regarding approving this application? It could be a motion to approve with standard conditions, or a motion to continue this hearing to discuss potential special conditions with the applicant.
Chair, sorry if I could raise
Yeah.
my hand quickly.
Yeah.
I think I heard from Board Member Lattimore there was a request. So
Yeah.
not a special condition, but perhaps the language could be a motion to approve with standard conditions and a request for an update on an MWBE policy in 2 years
In
with
2
the emission
years,
standard
yeah.
compliance plan. If that sounds right.
Yes, so moved as spoken by.
I was worried I wasn't going to get the language exactly right, so I was going to let.
I so move with a motion to approve with standard conditions, with a request to understand in 2 years upon submission of the emissions compliance plan, if have a review of any WMBE utilization as relates to the decarbonization plan work planned.
Second.
Right. We have a second. So on the motion to approve BMC's application with standard conditions and a request for an update on the MWBE plan in 2 years, how do you vote? In favor, opposed, or abstain? I vote in favor. Counselor Coletta Zapata,
In favor.
Board Member Lattimore,
In favor.
Board Member Nelson,
In favor.
Board Member Stovall.
In favor.
Okay, the ayes have it. So the motion passes. Boston Medical Center's building portfolio has been approved per the regulations. The Environment Department will send a copy of the written decision letter within 7 days. Thank you for your presentation and for your responsiveness to the review board's questions.
Thank you all very much.
So thank you. We will now move on to the public hearing for Mass General Brigham. And I will hand the floor to representatives from Mass General Brigham. If you could introduce yourselves and start your presentation.
Thank you. I'm Dave Hanachek, VP for Real Estate at Mass General Brigham, and I'd like to thank the BERDO Review Board, Chair, Counselor, and the staff for their assistance in our application. We are here to request approval from the board for the MGB building portfolio through Pathway 2, blended emission standards. I will be joined by Jason D'Antona, excuse me, Director of Engineering, Dennis Villanueva, Director of Utility Strategy and Procurement. I will give a very brief overview of how we relate to the community. Next, please. A highlight here is that MGB is deeply committed to caring for its community, and we're in a unique position to make a significant impact. Community benefits, including investments in health centers, community health needs assessments, and to the health safety net program, have gone from $225 million in 2021 to $350 million in 2024. Next, please. And highlight here, the Sustainability Impact Report outlines our understanding that climate change is a public health crisis and outlines our approaches to lower emissions, using more clean energy, reducing waste and increasing recycling, improving resiliency, integrating climate health and sustainability into our missions, research, clinical care, training, and the community itself. I think we can move on at this point to Jason D'Antona to give some more detail on the environmental engagement and decarbonization plans. Jason?
Thanks.
Next, please.
Thank you. Yeah, what I want to briefly highlight here is some of our work associated with our Scope 1 and Scope 2 emissions reductions. Scope 1 and Scope 2 emissions are by no means the totality of our greenhouse gas emissions, but they make up a large chunk of our emissions. We have many initiatives moving forward through the Center of Environmental Health, which is led by clinical teams, which is looking at Scope 3 emissions. Dennis and I and our team of engineers and architects are working primarily on Scope 1 and 2 emissions. We have a long history of being leading on emissions reductions. In fact, we started our Strategic Energy Master Plan is almost 15 years ago to reduce our net consumption of all energy, including fossil fuels. And that culminated in work to use waste steam to heat a portion of our campus. We've also, in the last 10 years, cited numerous megawatts of on-site and off-site renewable energy projects. We have many facilities with solar and other renewable resources. And we also have many offsite, including the Atrium Wind Project and a solar project in West Texas. Let me go to the next slide. I'm heavily involved in a decarbonization master plan. Our decarbonization master plan will be finalized later this year. There are three main aspects for our decarbonization plan. First is energy efficiency. In the last 10 years, we've performed over 150 energy conservation projects throughout the network, including lighting retrofits, HVAC retrofits, setbacks, and improvements in our central plants, including heat recovery chillers, and modernizing our technology for controls. We are looking now for electrification and any opportunity. As a matter of fact, the new building, the new Cambridge Street building, will be nearly all electric, and will use state-of-the-art heat recovery systems. And then wherever possible, we're looking to deploy renewable resources, including solar and other technologies. That's the next slide.
Yeah. Dennis Villanueva. Dennis. Where's Dennis?
Sorry, the typical mistake.
There we go.
Good afternoon, Chairperson Boatwright, Councilor Coletta, and rest of the review board and the BERDO team. I'll take it from here. We are requesting the approval of a building portfolio through Pathway 2, mainly to two criteria of on-site campus district systems with non-renewable CO2 emitting fuels located in environmental justice populations, and also on-site combined heat and power plants located in environmental justice population. Next, please. We have a slight change from our original application a few weeks ago. And one is to update the square footage on our complex for CRP. There are three buildings that are shown there in the picture: 165, 175, and 185. And 165 and 175 have some retail space that we needed to adjust the square footage and report for that space. There were no BERDO IDs for those spaces before, and we're adjusting for that. Additionally, we are also requesting the integration of the Simkes building. It did not have a BERDO ID either. We plan to integrate it into this portfolio. This is a research building in the same plaza. Next, please. So originally, we had requested the integration of 30 buildings with a total of 10.9 million square feet. We are adding about 380,000 square feet due to the reasons mentioned before, and we're about 1.341 million square feet. That's the list of buildings, and highlighted in the end is the new building that we are requesting to add to the portfolio. Next, please. This is our representation of where our local presence is. It's majorly in three areas. Is the western areas where Mass General Hospital and Mass A&E campuses are. There's also some presence in the Charleston Navy Yard, strong research buildings presence there, and in the Longwood Medical area where the main campus for Brigham and Women's Hospital is. We also have a few other facilities in surrounding areas. Next, please. And what this shows is the end use, square footage by end use, original and the updated one. We also updated our blended emission standards proposed to meet for our BERDO obligations. It's pretty much unchanged from the previous one. just with a slight difference on years 2025 to 29. Next, please. This is a representation of our buildings when it comes to location in environmental justice populations. So the large majority of our presence here, 83% of MGA's building square footage, is in EJ neighborhoods. Dividing this by buildings, 23 out of 31 buildings are in EJ populations. However, 4 of these buildings as defined by BERDO, and actually 2 large campuses, account for 57% of that area. Next, please. We are also listing here our district system suppliers. The first table is a list of buildings supplied by MATEP. They are, some of them are supplied with, or all of them are supplied by either electricity, steam, and chill water. The second table below is facilities that are supplied by Vicinity, and they only supply steam for our facilities there, providing great resiliency, both MATEP and Vicinity. And lastly, we're listing our combined heat and power plants. One of them, which is Brigham and Women's Hospital, Shapiro Cardiovascular Center, and Hale Building. We have a CHP with a capacity of 4 megawatts, and this one is in an AG neighborhood. The other 2 are Faulkner Hospital and Spalding Hospital in Charlestown. Next, please. I think that's probably the last one. Yeah, that's it. Thank you, and we'll welcome your comments and questions.
Thank you. I will now turn it over to Environment Department staff for comment.
Thank you, Chair. So when Mass General Brigham initially submitted their application, we worked with them to ensure that we had the correct GFA, and we updated some information, but after that revision, we found the application to be complete. MGB appeared before the review board on January 13th, and a hearing was requested because the board members wanted more information regarding MGB's community engagement. Since then, as Dennis mentioned, MGB identified two new buildings that needed a BERDO ID or a shift in GFA. Those changes have been complete, and so that just makes the total number of buildings in this building portfolio go from 30 to 31, or sorry, number of BERDO IDs from 30 to 31. And we recommend approving with standard conditions. Thank you, Chair.
Thank you. I will now ask the board if there are any questions or comments that they'd like to discuss. Before we start, I'll note again that if we're entertaining special conditions, we'll have to continue this application to a following hearing in order to review and discuss the special conditions. We may also make requests of the applicant for items we would like to see in their emission standard compliance plan when it is submitted in 2 years. As a reminder, if we make requests that have to do with the emission standards compliance plan, those are not considered special conditions. So I will start, and I just wanted to understand when it comes to community engagement, and do you have one uniform strategy for the whole portfolio, or is it somewhat localized based on the location of the buildings?
Best to answer that. So I will say it's localized probably by campus as opposed to one uniform. We are in different areas. We have different sets of issues.
Okay. That's helpful. Thank you. Board member Coletta Zapata, or sorry, Counselor Coletta Zapata.
No worries, Jessica. Chairwoman, excuse me. I want to thank MGB for their presentation and just your continued work always to provide high quality care for our residents, including my mother during COVID. So just thank you. I also want to thank and acknowledge the many members of CIR who are on this call from what I can see based on the attendance list. And so I think I'll just opine for a second. So as we consider this application, I think it's important to just broadly recognize that environmental justice and the labor movement are deeply connected. At its core, BERDO is about correcting long-standing inequities and ensuring that those most burdened by pollution and climate risks finally see real benefits from decarbonization efforts. And so it's not enough to reduce emissions if the people who sustain these institutions, the resident physicians, the interns, the workers are themselves struggling to survive in the city they serve. And so, yeah, just want to say environmental justice means investing in healthier communities. Labor justice means investing in the people who keep those communities alive. That's what true sustainability is. So feel free to comment or not comment on that statement. That's fine. I think we'll hear more in the public testimony portion. But for now, I'll reserve my one question. And full transparency, I represent Charlestown. But since a large majority of your buildings are located in EJ neighborhoods, how is MGB prioritizing early investments and emission reductions in those communities?
Thank you, Ben.
I can take this one, I guess, and Jason, you can support if needed. But we are still working to finalize our decarbonization master plan. Hopefully by the quarter of this year, and we don't have the details. This is going to be first the largest master plan, and then we go into the specific plans for each institution. As highlighted in the slides, the large majority of our square footage is in EJ populations. So pretty much, especially Mass General Hospital, Mass Anier, and Brigham. And pretty much anything we do will affect those communities. So that's what I can opine right now.
Is there any, do you have, I guess drilling into the chair's question, based on those disproportionately impacted the most, is there a plan in place to go out to those communities first? Like, how are you tiering them? How are you prioritizing them?
How are we prioritizing them? So the two largest campuses that we have, I mean, Mass General and Brigham and Women's Hospital, are on EJ populations. That's where the majority of the work is going to go. And so at this point, I don't have any more details on the decarbonization plan and prioritization, but pretty much anything that we do is going to positively affect the EJ populations around those large hospitals.
One last thing is just that I will call out the fact that the Charlestown campus directly abuts the largest public housing development in New England at Bunker Hill. And just to consider that as you're doing your community outreach and your prioritization of emissions reductions in these types of neighborhoods. So thank you, Chair.
And we can look at it from the perspective of prioritization and get back to you on that.
Thank you.
Thank you. Thank you. Thank you, Counselor. Board Member Lattimore.
Thank you. I appreciate everything that Councilor Coletta Zapata said and echo her comments. So thank you, Counselor. I don't really have any questions. I just have a request for any that the emission standard compliance plan in 2 years include a review of MWBE utilization on decarbonization plan work. No other comments or questions.
Thank you, Board Member Lattimore, Board Member Nelson.
I have no questions. Thank you.
Thank you, Board Member Stovall.
I'm in 100% agreement with Board Member Lattimore. I think we should revisit it in 2 years.
Okay. Thank you. I will now, do any board members have any further questions? All right. So we will now open the meeting to public comment. As we talked about earlier in the meeting, so here's our public comment period. As a reminder to members of the public, please raise your hand or type in the chat. If you're calling in and you cannot use the platform, you can raise your hand by pressing *9, or send your comments to staff via email at BERDO@boston.gov. I am going to call on a number of people that I have seen. And so just so that people know that you are recognized, I'm going to start with, let me just.
Could I just make one like Zoom note that if folks are unfamiliar with Zoom, the way that you raise your hand is clicking the react button, and then it's like a heart, and then you'll have an option to raise hand. And I think for process, since there are a lot of public comments, if folks could try to raise their hand, if that's not working, you can put in the chat. That works.
Okay. Thank you. All right, and yeah, it is totally fine to use the chat if it's if your button's not working. So I am going to go in this order as it is what's showing up on my screen. Andy Krasner, Sandra Huckleberry, Leanne Canty, Elizabeth Tanton, Abby Ramanan, Barrett Neese, Mariko Peterson, James Sullivan, Dr. Taylor Walker, Lynn Johnson, and okay, that looks like those are the hands that I have right now. So so Andy Krasner, we can start with you.
Hi, thank you, board members, City of Boston staff, and MGB staff for the opportunity to comment. My name is Andy Krasner, and I'm a volunteer with Mothers Out Front. I'm a mother of 2 children, and I live in Jamaica Plain. I'm within a 1.5 mile radius of the polluting Maytep peaker plant in Longwood Medical Center. And professionally, my work focuses on air quality and climate policy. The BERDO policy was actually designed to improve air quality and reduce climate pollution. And I'm concerned about the Maytep plant that powers Longwood Medical Center, including Brigham and Women's Hospital. It emits a lot of pollution, including NOx and particulate matter. And in the presence of sunlight, the NOx that is emitted from this plant can chemically react with volatile organic compounds and contribute to high levels of ground level ozone concentrations. Particulate matter, ozone, and nitrogen oxides all increase the risk of asthma in our children. They cause worse asthma symptoms, and they increase respiratory symptoms and make lungs more susceptible to infection. And this is particularly worrisome in Boston, where 1 in 3 of our school-age children has an asthma diagnosis. So air pollution is largely invisible, but clean air is vitally important to our children to be healthy and to thrive in school. Boston College actually evaluated the health impacts of air pollution in Boston residents and found that air pollution in Boston is responsible for over 1,800 new pediatric asthma cases. And they estimated that over 200,000 performance IQ points were lost because of air pollution. My family has directly benefited from the care and research done at Longwood Medical institutions, and I'm very thankful for all of them. But the same hospitals that are offering us care are relying on dirty energy that pollutes our air and makes our kids sick. So I think it's time for Longwood Medical Hospitals to put pressure on their energy provider, Maytep, to follow the lead of their other energy provider, Vicinity, and move to cleaner energy. It's really important for our kids' health and success in school. And we think that there should be some provision on Maytep moving to clean energy. Thank you for your time and consideration.
Thank you. Thank you very much. We will move on to Sandra Huckleberry.
Hi, I'm Sandy Huckleberry, and my husband and I will both be giving some feedback here. I also live within a mile and a half, I think actually within a mile of the Maytep peaker plant. And the air quality falls at the 98th percentile rank for nitrogen dioxide and at the 89th percentile rank for diesel particulate matter as compared with the whole country. 48% of the residents here are people of color, 35% of the residents are low income, 8% did not complete a high school education. The majority of the neighborhoods surrounding Maytep are environmental justice neighborhoods. The people who, obviously, because of that, the people who live in these neighborhoods already face a disproportionate burden of environmental hazards, and Maytep is a clear example of this. Given the known negative health impacts of Maytep's emissions on nearby communities, I want to know what we are doing to keep our residents safe. I think that, you know, no one should have to breathe dirty air to keep the costs down for a hospital or an energy company. So I would like to know how we are regulating the particulate matter that's emitted. I also want to know who is keeping track of the increased particulate matter and its health implications. Also, how you're going about and who is educating the community about the risk they are taking by living near the peaker plant. And especially given that the buildings we are discussing are in the business of keeping people healthy, which I also benefit from because I use them and I'm very grateful that they're there. But I was thinking that the hospital, part of the MGH's responsibility should be to at least inform residents that are living within the mile and a half area within this and suffering from asthma and other things about the risk of living nearby and what health issues they should monitor for themselves. So, and I'm also going to turn this over to my husband, who is also going to say something at this time.
Hi, my name is Jeff Huckleberry, and I live within a mile of the Maytep peaker plant, and I have for almost 35 years now. I have asthma, which has led to some difficulties, especially riding my bike back and forth to work, and it's my preferred transportation. So the Maytep peaker plant's emissions have been shown to get deep into the lungs, which exacerbates my asthma. I want to know what measures are being taken to reduce the health impacts of Maytep's peaker plant. Thank you.
Thanks very much.
Thank you. We will move on to Leanne Canty, and I also will add Ginny Marcotte to the speakers list to the end of it. So Leanne, if you want to go now, that would be great.
Thank you. My name is Leanne Canty. I'm a resident of Jamaica Plain and a practicing internal medicine physician. I am also a volunteer with Mothers Out Front. I would like to thank the board for the opportunity to speak here today. I am here to urge the board to ensure that Boston hospitals, particularly MGB, comply fully with their BERDO requirements. It is well known and has been mentioned today that we're facing a climate emergency. Rising temperatures have many well-known health effects, from bothersome to life-threatening. Perhaps you've recently developed or noted that your seasonal allergies seem worse than they've ever been. You can thank climate change. In addition to worsening allergies, asthma severity and incidence is on the rise. Warmer temperatures have also been clearly linked with increases in mortality due to other respiratory illnesses, such as COPD, to cardiovascular disease and kidney disease, all of which we know also impact EJ communities more severely and earlier than other communities. Rising temperatures are also causing infectious diseases to spread. Infections spread by insects, including Lyme, dengue, malaria, and more, are now spreading to previously unaffected geographic regions. For example, Lyme disease is now being diagnosed in Canada and the Arctic, where it was previously unknown. In my own practice, I'm now diagnosing tick-borne illnesses year-round, as opposed to just seasonally. Heat waves are becoming more frequent, severe, and long-lasting throughout the US, including in Boston. Not surprisingly, heat exhaustion and heat stroke are becoming more frequent, and the number of deaths due to heat illness are climbing. Unfortunately, incidents and deaths from heat illness are also increased in EJ communities, such as where the majority of the MGB campus is. Interpersonal violence rates increase with increasing temperature, and it has been documented that a warming climate is associated with increased incidents of assault, sex crimes, and murders. In addition, rising temperatures are linked to worsened mental health, with anxiety and depression becoming more severe and a documented increased risk of suicide as temperatures rise. Our hospitals provide world-class medical care, and I am so grateful for that and for the career opportunities they provide. We must also insist that our hospitals promote health for our entire community by curbing their dangerous carbon emissions, and that MATEP, the power plant that powers our largest hospital, initiate significant decarbonization. We hope that MATEP would start with decommissioning their peaker plant. Thank you very much for this opportunity to provide comment today.
Thank you very much. I will move to Elizabeth Tampton.
Thank you very much, and thank you for the opportunity to make a comment. My name is Elizabeth Tampton. I'm the mother of two young children, ages 5 and 6. And I want to express my concern about raising my children in close proximity to the MATEP peaker plant, which provides energy to MGB. I think it's of note that MGB is among the highest emitters of carbon in the whole city. And I want to express my concern for others who may not be aware of the health risks that they are exposed to by living in this area of the city. When I was pregnant with my first child, I lived 1.7 miles away from the MATEP peaker plant. I currently live a similar distance from it. I was fortunate to have an uncomplicated pregnancy and delivery, but did not know that my address made me more susceptible to giving birth prematurely. So living in close proximity to the MATEP peaker plant introduces a host of health risks to developing children. This is especially true for those living in a 1.5-mile radius, but particulates can travel, and this is often exacerbated by weather conditions like wind. Fine particulate matter released by the MATEP peaker plant can lead to asthma, stroke, and an increased risk of diabetes. I want our community to be able to raise children in an environment with clean air that will not harm them. I am asking that we decommission the peaker plant, which uses diesel fuel. I am also asking that MATEP take steps to improve the efficiency of energy that is produced for MGB. Ultimately, I believe this requires moving away from fossil fuels. I understand that this comes at a cost for the hospital, but I want to underscore the hospital's mission. Mass General Brigham, and I quote, "Mass General Brigham is committed to serving the community. We are dedicated to enhancing patient care, teaching and research, and taking a leadership role as an integrated healthcare system." And I think that MGB does a great job in many ways doing that. But I think that if MGB is truly serving the community and serving as a leader as an integrated health system, they have an obligation to invest in cleaner energy sources that do not harm their staff, patients, and community. For the sake of the children in the neighborhood, MGB must invest in clean energy because our kids deserve to breathe cleaner air. Thank you.
Thank you
Well-
very much. Moving on to Abby
Okay.
Ramadan.
Hello, my name is Abby Ramanan. I am a project director with Clean Energy Group. We're a national nonprofit, and through our Phase Out Peakers initiative, CEG has been working to accelerate the retirement of fossil fuel peaker plants and their replacement with clean energy and energy storage alternatives, including in Massachusetts. And I'd like to speak specifically to the feasibility of decarbonizing the medical area total energy plant. I strongly encourage the board to consider imposing a special condition on MGB requiring that they explore at minimum decarbonizing the diesel peaking units at Maytep in collaboration with the Longwood Medical Energy Collaborative. Based on our analysis of the most recent generation data on Maytep available from the Energy Information Administration, the diesel peaking units at Maytep are collectively operating for less than 50 hours per year, some significantly less than that. These units are particularly harmful because unlike a baseload plant, which operates continuously, peakers start up and shut down often. Most emissions control technologies do not operate during those periods because the plants need to come up to temperature for them to be effective, meaning that air pollutant emissions such as nitrogen oxides are unabated during startup and shutdown, as well as any testing the plant has to do as part of these units remaining online. The short duration these plants are required to operate makes them uniquely suited for replacement with battery storage, and this would have an outsized impact on air pollution levels in the surrounding community. Based on the low utilization of these diesel peaking units, it'd be very feasible in the short term to either replace the existing capacity being provided by the diesel units with 4-hour battery storage units, or just to retire the units without replacing the capacity at all. Doing so would remove a significant source of air pollution to the surrounding community, and CG is happy to answer any questions or provide additional information on the feasibility of replacing or retiring those units. And thank you so much for your time.
Thank you for your comment. Dr. Garrett Nees is next. It looks like you unmuted your device, but we still are unable to hear you.
Sorry, Dr. Garrett Neese, if you're speaking, we can't hear your audio. I'm not sure if he can hear us. I can send I can send him a message directly if you want to
Yeah, I
continue
put
down the
something in
line.
the chat, but I think maybe Diana, if you can also try messaging him.
Yeah, I'll message him.
Okay, that would be great. And we will move on to Dr. Mariko Peterson. And I just want to note that I am also adding Marianne Nelson to the end of the speaker list.
Hello, can everybody hear me?
Yeah.
Perfect. Okay, so my name is Dr. Mariko Peterson, and first I'd like to thank all of you for having us here today for the presentations that were delivered today. I'm currently a third-year resident in pathology at Brigham and Women's Hospital, so on the Longwood campus. And you might be wondering why are doctors fighting for a fair contract testifying here today. As some of you may know, I'm a member of CIR. We are trying to fight for a fair contract with MGB currently. And we'd like to kind of dovetail with some of the comments that were made earlier in that labor justice is not just about fighting for fair wages, worker protection. It's also about fighting for worker protections and economic justice, as well as racial and gender equity and the fight for human rights. And at the center of all of these rights is a goal of achieving fairness, equity, and dignity for everybody. And so therefore, at the base of all of this, labor justice is also the fight for climate justice. We know how much MGB exploits its workers. One of the ways in which it does that is that it has closed many primary care offices throughout the community. This obviously affects the community in that they're not able to access the backbone of medicine through their primary care offices. As many of you have experienced, the wait times are crazy. And they just don't have the support, either the staffing support for administrative workers, nursing, et cetera. But that also comes with not providing primary care for resident physicians as well. In fact, as a patch, MGB have suggested that we go to One Health, which is Amazon's primary care alternative. And as many of you know, Amazon is another very large polluter in terms of releasing many tons of plastic into the environment, as well as transportation pollution. We also know that from much of the testimony here today already that MGB is a very large, in fact, the biggest polluter in the city of Boston. So at the bargaining table, we won't let executives offer us pennies because we know our worth and we know that when we have the support we need at work, our patient care thrives. This is obviously true with the primary care that they provide, the access to good, clean environments, as well as the access to housing and good, healthy environments. So I'm here today because I'm calling on you to not let MGB get away with skirting environmental regulations that are set in place to protect our Boston. So we ask that the BERDO board deny the building portfolio application from Power Options on behalf of MGB in light of their continued public health harms against the environment, patients, and the surrounding communities and workers at MGB. MGB is actively negotiating a contract with our union, as I mentioned before. We ask that BERDO not grant any leniency at a minimum until MGB takes care of its workers and settles our contract. Additionally, as we've heard before, there really are only concepts of a plan. And as we've also heard before, these are very real consequences for members of our community, including exacerbation of asthma, issues with premature deliveries, et cetera, et cetera. And so we can't really afford to sit on, not having a clear plan, which is essentially what MGB have proposed. Thank you.
Thank you. Thank you very much. We will move on to Dr. James Sullivan.
Can everybody hear me?
Yes.
Beautiful. All right. Good afternoon, everyone. My name is Dr. James Sullivan. I'm a resident physician as well and a member of CIR in the internal medicine department at Brigham and Women's Hospital. When you have an emergency at home, you call the paramedics. When you have a rodent that you need removed, you call inspectional services. But who do you call when the city's largest healthcare system, the system that's responsible for offering quality care to the people of our community, is also the city's largest polluter? What do you do when that system is responsible for the continued degradation, as we've heard, of our community's environment and health? What do you do? What I'm doing is speaking up and asking for help. Managing a polluted environment is a conundrum. It's a tragedy of the commons, as the common metaphor goes, where it's hard to draw firm lines in the sand because each of the harms of delays are diffuse and they're deferred. But these harms and needs are critical, as we've heard from many other community members today. The WHO, the World Health Organization, calls the climate crisis the biggest public health emergency of the 21st century. Granting MGB leniency here harms human health. It harms our community. It harms our kids. It disproportionately harms marginalized and minority populations already under so many public health threats because of inadequate policies and systematic failures. Air pollution is estimated to be responsible for 15% of deaths worldwide. Let's stop that in Boston. Let's not let MGB continue to commit continued environmental justice harms without any clear plan to actually prioritize these vulnerable communities. I grew up outside of Boston in the Acton, Massachusetts EPA Superfund site from Grace Chemical in the late 20th century. The connection between the environment and health is particularly close to my heart. I lived in Boston before medical school and moved back for residency at MGB and hoped to practice medicine here for my entire life. Part of my motivation to be a doctor in the first place stems from the environmental travesties that have impacted human health, such as the leukemia cluster, childhood leukemia cluster in Woburn, Massachusetts, right in our backyard, popularized by civil action many years ago, and of course the ongoing climate crisis. I've studied the impact of the environment on human health. I've published scientific articles on the topic and taught a range of health professionals about this direction in my career so far. And I'm incredibly proud to work in Boston as a doctor because I know that there are community members, government officials, and systems in place to stop that tragedy, the commons, and protect all of human health, including prioritizing a healthy and safe environment. I don't think MGB's plan here is adequate, and they can do better. I humbly ask the BERDO board to deny the building portfolio application from Power Options on behalf of MGB in light of their continued public health harms against the environment, patients in these communities, and the workers at MGB. MGB is actively negotiating a contract with our union, and we ask that BERDO not grant any leniency at a minimum until MGB takes care of its workers and settles our contract. Please don't push this back 2 years. This can't wait. Thank you very much.
Thank you for your comment, Dr. Taylor Walker.
Hi, can everyone hear me?
Yes.
Excellent. Good evening, everyone. My name is Dr. Taylor Walker. I am the National President of CIR-SEIU. We are the nation's largest physicians union, representing over 40,000 residents and fellows across the country. So first off, I want to thank the members of the BERDO board for holding this hearing and standing up for environmental justice for the people of Boston. While I am not a native Bostonian, I have spent most of my adult life in Boston, from undergrad at BU to working for the Boston Bruins during their Stanley Cup winning season, then on to residency and working as an attending at Cambridge Health Alliance. I also served as CIR's regional vice president for New England, and I now consider Boston my home. I'm very, very proud to see my city councilor from Charlestown here on this call this evening, and to hear her speak on the intersection between labor justice, workers' justice, and environmental justice, because they are, of course, one and the same. Resident physicians who work at MGB and are members of CIR-SEIU are here today because, like you on the BERDO board, we believe that it's important to stand up for what is right and what is just, not just for ourselves, but for our communities. As I mentioned, we know that the fight for workers' rights and workers' justice is the same as the fight for environmental justice. These things are inextricably linked. Fighting for justice means taking back what belongs to the people and to the community, specifically a quality healthcare system that prioritizes public health and wellness and access to a safe environment with breathable air over corporate profits and the bottom line. So it means holding people and primarily institutions like MGB, accountable when they don't have the best interests of Bostonians at heart. MGB is the largest employer in the state of Massachusetts and has the largest negative environmental impact of any institution in the city. So like you, we're fighting back against MGB's executives' profit-driven business model that allows their CEO to take in over $6 million a year in salary, while resident physicians working over 80 hours a week are struggling to pay their bills, right? Some are even having to sell their plasma to make rent. I had to take out a personal loan to make rent in Boston. We are demanding dignity and respect for all of the people in Boston and all of our workers at the bargaining table. So at this hearing and in the state capitol, because what the MGB executives are doing is not right. We ask that you continue to stand up for environmental justice and for workers' justice. I'd like to reiterate that we at CIR are asking the BERDO board to deny the building portfolio application from Power Options submitted on behalf of MGB in light of their continued public health harms, both against the environment and against patients in the surrounding communities, and especially the workers at MGB. MGB is actively negotiating our contract, as you've heard several people speak to this evening. We ask that BERDO not grant any leniency until MGB takes care of its workers and settles a fair contract with our residents and fellows. Thank you so much.
Thank you very much. Lynn Johnson.
Hi, my name is Lynn Johnson, and I live in Brookline Village, just 3/4 of a mile from the Peaker plant. I've watched emissions coming out of that plant for many years and wondered what the impact that it might have on my family's health and the health of other families, especially those in environmental justice communities. What I've learned about the high levels of particulate matter coming from the plant have been really upsetting. Moving toward clean and renewable sources of power would make a big difference in improving public health, but also in meeting Massachusetts climate goals, something I've been working on as a volunteer for Mothers Out Front in Brookline. I've gotten excellent health care from the Brigham over the years, and I consider myself lucky to live nearby. But the irony of the plant's damaging role to our climate and health is deeply disappointing and needs to change sooner rather than later. Thank you.
Thank you for your comment. Jenny Marco.
Hi, this is Leanne Kitty, and Ginny unfortunately had to go and is not able to comment, but she would like to submit it electronically via email.
Okay, great. That would be great. Thank you very much.
Thank you.
Chair,
Marianne.
Oh,
Yeah.
sorry, Chair. I'll just make a note. I'll
Yeah.
share the email in the chat.
Great. Thank you. Marianne Nelson. All right, it looks like Marianne Nelson may not be on anymore. So if anyone works with her or knows her, she's welcome to also submit via email, and we will try Dr. Nees again. I'm hopeful that your audio. Oh, I'm sorry about that.
My mic wouldn't turn on. I'm sorry.
Okay.
I didn't know I was supposed to measure the distance from my house to the plant. I'm sure I could walk down there in about 15 minutes from Mission Hill. I think the BERDO board should deny Mass General Brigham's application. I think Mass General Brigham, which prides itself as being one of the best hospitals in the world, should step up, figure out how to stop emitting pollution so much, improve its energy efficiency. I'm sure that they could just go talk over to a couple of people over at MIT, and they can set up some batteries in their basement to store the off-peak energy that's produced for a peak need. Currently on Mission Hill, we have to suffer all the ultra-fine particulates that come from everyone commuting to and from the to Brigham and Women's and the other hospitals. And I had totally forgotten about the fine particulates until I heard about this issue coming up today. And clearly presents definite health issues, as other people have said. We don't have health statistics for Mission Hill specifically. Anecdotally, I know of a couple of people who died of asthma-related issues in their homes not far from the power plant. I'm sure it wouldn't be surprised if it were related. I think Brigham and Women's needs to step up, do the right thing, reduce the emissions. I think and it won't do it until it's forced. It's very good at letting things things that are not as important to them as other things, meaning the management slide, delay, get the easy way around. And we shouldn't let them to continue to do that. They should live up to their responsibility and address the pollution coming out of their plant. The peaker plant should be closed first, and they should work towards moving towards clean energy and closing the plant down entirely. Thank you.
Thank you. Dr. Nees, we can try again for your comment.
Thank you. Is that working?
Yes.
Fantastic. Good evening, everybody. Thank you for your patience. My name is Dr. Garrett Canese, Regional Vice President with CIR. I'm a physician and a public health practitioner. I decided to become a doctor and a public health advocate because I intend to serve the well-being of my communities locally and globally at both the individual and population levels. And it's vital that these regulatory structures and environmental systems that determine the viability of our public health efforts truly and authentically promote the health and well-being of our patients and our neighborhoods. This is the core of the work that I and my colleagues on this call do every day. The lasting effects of a healthcare system that prioritizes profits over patients and the health of their communities are evident in cities across the nation, including Boston. MGB continues to show us that they are prioritizing their profits above all else. I originally come from Texas, where very poor environmental regulation and accountability of industries, both in and out of the health sector, has resulted in significant measurable and lasting negative health impacts. Health disparities then persist across these various social determinants affected, with issues like unsafe housing due to locality, environmental injustice feeding into that, and inequitable access to care, highlighting all of the problems that these inequities and disparities create. And it's this industry exceptionalism in healthcare that is contributing further to these unethical environmental injustices. And that is what MGB is seeking in this case. It is at least ironic and egregiously unethical at worst that this not-for-profit healthcare organization with billions in financial reserves continues to attempt to minimize its investment in the welfare of its surrounding neighborhoods in the face of our mounting climate crisis. While their CEO gives themselves 40% raises in recent years and continues to work against providing livable wages for its resident and fellow physicians within its profit-driven model, truly. We are petitioning this board not out of concern for ourselves, but out of concern for its holistic impact on this community and a consistent interest in their own bottom line being quite problematic. We think that it's time to hold MGB accountable and ensure that our communities and our workers are safe from this type of corporate greed, and that we deny their application today and not 2 years from now. Thank you all.
Thank you. I believe that is the that we've received all the public comments. I do want to do a time check for board members. Are board members able to stay an additional 15 minutes to continue to finish discussion on this agenda item?
Yes, for me.
Okay. Board member Nelson? It looks like a yes. Board member
Yes.
Stovall?
Yes.
Okay. All right. Thank you for that. So we will adjourn at 6:45 so that we have a little more time for discussion. Are there any further discussion or questions on this application?
I just have one question for staff. Thank you, Chair. I think it would be useful. I mean, I do want to say that I deeply respect and understand the urgency of CIR's concerns and the importance of winning fair wages and conditions for resident physicians. I would like the staff to just talk about this board and our authority and our role. Just because we are narrowly focused on determining whether building owners like MGB have submitted building portfolio and compliance plans that meet specific technical requirements. So if we were to deny an application based on labor disputes, does anybody have an answer of like if that could open the city or the board to legal challenges for acting outside the scope?
Yeah, I'm happy to answer that. So thank you for the question, Councilor Coletta Zapata. So there are a few things I think that are helpful to clarify for the board and for all of the folks on the call who made public comments or otherwise listening as well. So the way that the regulations are set up is for the applicants to come forward with portfolio applications. And then if they do have those environmental justice criteria like MGB has, then the requirement is to come back with a emissions compliance plan within 2 years that provides more detail on how they will achieve kind of what their strategy is across their portfolio for their emissions reductions. And so it's not a delaying of the action. The limits are, as with all of the other portfolios, it's just allowing that compliance at the portfolio level rather than a building by building level, but still has to maintain that overall emissions reduction and step down to net zero emissions by 2050, like all of the other buildings subject to BERDO. The other piece I do want to flag for the board is that any decisions around special conditions per the regulations need to be based on eligibility criteria, which MGB has met all of the eligibility criteria, and then consideration of potential impacts on and benefits to environmental justice populations. And we have also provided the board kind of guidance on that, and our recommendation is to make that as kind of closely tied to the distribution of benefits across the portfolio as possible, so that there is that kind of link. I would say that, I think these topics are related, but the issue at hand tonight really is about whether MGB is warrants their application is complete and provides enough information for the board to determine if they should have an approved portfolio for BERDO. And then similarly, I think the point I want to make around precedent is important too. So as the board is making decisions, the board is setting precedent for future board decisions as well. And the board has approved similar hospital portfolios that are connected to MATEP, for example, or have CHP systems too. So I just want to also put that context in place as well. But happy to answer any other questions on that. And then just one other, this is not directly answering your question, but just because I can anticipate this next question, which is, I know there were a lot of comments tonight around MATEP and the regulation of MATEP. And just if I may make a point to those on the call, the Department of Environmental Protection at the state level regulates the emissions from the MATEP plant and the air pollution from that plant. And then separately, MATEP is a separate entity, so MGB does not own MATEP, and so we can't, the board can't assign any conditions that are directly saying specific requirements for MATEP, since that is a separate entity that contracts with MGB and several other hospitals in the Longwood medical area. So just wanted to make that point of clarification as well.
Thank you. Counselor, did you have additional questions or clarification?
Thank you. One last question. In order for this to pass, I should know this. Does it need to be unanimous?
Diana, no, no, it needs a majority vote.
Okay, thank you.
All right. Are there any further discussion or questions from the board? All right, I do have a question about the MATEP plant. I understand that it's not owned by MGB, but is there either a long-term conversion strategy being considered by the ownership of MATEP, and or does MGB have any plans to sort of move further and further off of any traditional sources that are being used at MATEP? Sort of what's that relationship in terms of looking future, in terms of the future of MATEP and the relationship of MGB and MATEP?
So as Hannah noted, Brigham, as well as several other hospitals, are under long-term contract through 2051 with MATEP. We are committed to meeting BERDO standards and continue to explore options to do that. And I think I'll leave it there.
And I will just also note that like BERDO staff, we have been in touch with MATEP and have had several conversations with MATEP about their decarbonization strategies and could provide more information on that. And then also with the hospitals and kind of strategizing on that. So it's a complex issue that we're aware of and working on.
You know, I certainly appreciate the community concerns and, you know, am also concerned. As I'm interpreting what you're saying, Hannah, it sounds like other than abstaining from a vote, we're compelled to approve this, if I'm not mistaken.
So the board could consider special conditions, but we would need to continue the conversation and know kind of what special conditions you would want to entertain and how they're related to the application before you. So I think if there are further questions of MGB or special conditions, what we can't do is assign special conditions at tonight's meeting without kind of having MGB have a chance to respond to those and see if they're able to meet those special conditions, for example.
Well, you know, given the context of this board, this meeting, and while I'm sensitive to everyone's plight, I motion to approve the building portfolio application submitted by MGB.
Is there a second from the board? I'll say personally, what I'm struggling with is that I think that I think that what board member Nelson has said makes sense, and that in a way, one thing that is challenging about this decision is that what we're doing is approving a plan that makes MGB accountable, right, for reducing their emissions. And so I'm
we're not relieving
yeah,
them of the
right,
burden of BERDO.
Right. In fact, we're creating a we're creating a plan for them to be compliant, or we're creating a plan for them to reduce their emissions over time. So
Chair,
yeah, sorry, yeah, Diana.
No worries. No worries. I understand this is there's a lot of good feedback and comments that were shared today. And I don't know if this would be helpful context as well during, you know, the intention of the emissions standard compliance plan that's submitted 2 years post approval if the portfolio triggers sort of the EJ criteria, is meant to be the place for a building owner to start at least doing that long-term decarbonization strategy, because uh, as folks know, BERDO is really meant to sort of shift the culture around building emissions where, long-term decarbonization strategies are more common, but recognizing that building owners across the city are starting from different places. So the emission standard compliance plan in 2 years is really meant to be like a starting place or a foundational place for building portfolios. I don't know if that's helpful for this conversation today. I know it sounds like there are a lot of community concerns about having a plan in place today, but in terms of the context of BERDO, it does allow for that 2 years.
Yeah, and
I
just
think, yeah.
Oh, just adding that the board can also request for, specific information in that, or like more information in that as well.
In the 2-year plan.
Yes, as you've done with other applicants.
Yeah, there's many hospitals and other entities that draw off of the MATEP plant. And this board has already approved these applications.
Right. So,
2-year plan,
yeah.
personally, we just did it a few minutes ago. What's the difference? Make them come back in 2 years if we're gonna do this. We're not gonna hold their hand. They have the money to shift gears. They're not a little small business. They have the money. 2 years.
They will.
So, Board Member Stovall, would you, I should say, clarify, are you saying that, are you recommending a motion that requires them to report on moving away from reliance on that plan over the next 2 years?
Yes.
Yeah. Yeah.
And is that something that can be done within our purview to make that type of request or information that speaks to how they are either moving away from that plant or exerting their influence on the plant making changes? Is that outside of the scope of what we can actually ask for, make a request on?
I think I'd want to be careful about how we word it. But I think that asking, what MGB's overall decarbonization strategy is, including and like how that is being sequenced with their overall emissions compliance plan, and asking about how connections to district energy systems are part of that decarbonization strategy would maybe be how I would word it.
That's exactly it.
Yeah. And
That's
I
great.
guess, oh, sorry. Did I cut you off?
No. I'm just,
Okay.
I agree with her 100%. I just
Okay.
didn't word it properly. I'm sorry.
No, it's, I also, I want to share that, this feels like a hard one, because of the size of the portfolio, the size of the organization, and the number of thoughtful comments we've received. I also am thinking as a board member about, if we don't make this decision, then ostensibly we're pushing out the time period under which MGB will start to be measured and accountable for reductions. And so, so the board is sort of equally conflicted, because I think we've heard some good, we've heard some really thoughtful comments and important comments about messaging around overall impact of how the hospital operates, but in effect we lose some of that leverage to be able to really look at environmental impact if we don't start off with a plan that we can measure from. So
I would
so let me, yeah.
I would amend a motion that was on the table to include the wording per the motion to, I don't know how to do this in terms of Robert's rules and all that, but a friendly amendment to include what Hannah Payne put on the table, or rather, either a friendly amendment to the motion on the table to include the language that Hannah referenced, or a new motion. I'm not sure how, but process-wise to do it.
Chair, one more thought. In addition to Hannah's language, I did hear Board Lattimore earlier also ask for the emission standard compliance plan for an update on MWBE utilization policy. So it'll be a wordy one, but I believe the motion is approved with standard conditions with a request in the emission standard compliance plan for an update on decarbonization strategies, including plans regarding connection to district energy systems, and an update on an MWBE utilization policy.
Thank you, Diana. So that's
a
motion I moved as per what Diana put on the table.
okay. And I would second that motion. I just want to clarify also that that standard conditions also include, timely compliance with all reporting and third-party verification, that and submission of plans, and that and the standard conditions also include that the review board or its designee may inspect any building that is part of an approved building portfolio at reasonable times and with reasonable notice in order to assess compliance with the terms and conditions of said building portfolio, meaning that BERDO staff continues to monitor the implementation of these plans over time between now and the 2-year mark. All right. So we have a motion on the table. I will call on board members as to how they vote: in favor, opposed, or abstain. I vote in favor. Councilor Coletta Zapata.
Opposed.
Okay. Board Member Lattimore.
In favor.
Board Member Nelson.
In favor.
Board Member Stovall.
In favor.
All right, the ayes have it. The motion passes. It is, I'm going to close the public hearing, and looking at time, I'm going to propose that we move the minute approval and administrative updates to our next meeting. Okay. Do I need to call the public meeting to order in order to call for a motion to adjourn?
No, if you'd like to just go straight to adjourn.
Okay. All right. I am going, I want to thank everyone who's came here tonight, all of the thorough presentations and thoughtful comments. They were all really meaningful and helpful to myself, and I believe to the rest of the board. And I make a motion to adjourn this meeting. I have a second.
Second.
All right, and if board members could either raise a hand physically or using the Zoom application, or unmute yourself. All right. Okay, all right, unanimous motion to adjourn. Thank you all very, very much for your time, and we will see you in 2 weeks.
Thank you.